We are going to discuss the issue of pain and how we can resolve it in a simple way.
There's a very important thing that I think you bring up here, Uzzi, is understanding that there is a higher level to how these people get into pain syndromes and cycles. It can initially start out as an insult where you have some initial inflammatory cytokines and chemokines that are present at that site of injury. But what happens is the immune system can come into this equation and can do things to aggravate and continue this process of the pain inflammatory response. It's a really underestimated aspect of what we see every day in our practices.
There's a very common condition that's called endometriosis, that causes silent pain. Not all the time you can see it and hold it. This is also inflammatory and autoimmune disease. And by knocking it out with pain medication, we do nothing, we just harm. Regular medical solution to pain is usually harsh, narcotic, addictive medication, or anti-inflammatory that destroy your gut, cause uncontrolled bleeding, cause kidney disease, and more and more. And we can use all the magic of peptide by addressing it. And whenever somebody tells you, oh, we don't know why you have it, we know and we can heal it. Never agree to hear that we cannot do anything about it. What we do with the nutrient, with the hormone, and with the peptide, we deal with the origin of the pain. And that's why we treat it, really avoid it from coming back. So everything that's painful in your pelvis, in your abdomen, in your bladder, we know what to do for it. We know how to solve it. And we know how to heal you. There is solution. And the solution is simple. They have no deleterious effect on you. And we can really help. I can tell you, there are situations that are very complex. It's a new field. It's totally new field. He's the originated, the ability to deal with it. So, and I have no ego. If I deal with a situation that I've never seen or I'm not solving, I don't think twice by looking for his advice. And he always will come with different combination of peptide and nutrient that will further improve the healing process.
I think the value in what we have is we talk about these patients together. We'll throw ideas back and forth, and that's really the key to taking care of people with complex issues.
Just something from this weekend. Every man that is young and feel dreadful to look one day like me and lose his hair is given medication called Propecia. And that's a human killer. In good proportion of times, those males will not be able to function sexually. It affects the heart, it affects the brain, it affects so many organs in the body. And there was other complicated issue, and indeed he helped me in this situation, coming with more original thought process how to solve it.
I think that's what makes this interesting. It's when you have these people that come with no hope, or they've exhausted their search, and they've been told there is no answer, and Uzzi and I just don't accept that. We're all about thinking through issues and problems because there is an answer. There always is an answer. There's lots of these things that people just kind of let go. They don't understand that it over time it becomes more of a progressive problem, like pain in the fingers or loss of sensory or pain in the elbow that they get by with every other weekend until they are doing something. They're playing golf or tennis, or they're out there with their kids, and they all of a sudden it becomes more of an issue. These are things that absolutely can be addressed and taken care of, and long-term can be prevented. This isn't treating a problem, it's preventing a problem and preventing the end part of that.
Most of them had looked for solution, but the solution was harsh, was steroid, that gave just partial response.
Right.
Medication, they had a lot of side effects and never really solved it in its root.
Right.
And then they stopped to look for solution.
Right.
They said, I'm going to quit golf. That's
Right.
it.
Right. They become less confident in themselves. They have other issues of maybe partial depression or anxiety over the issue that kind of leaks into their work. It leaks into their personal life. These are people that can become dependent on medications, dependent on other things to try to occupy their mind, and have been told there's not much more they can do. They've had failed surgeries, and those issues are interesting in the fact that people don't understand that there are things that can be done in a healthy way to not only stop that, prevent it in the future. You have to think about pain in a very different fashion, and that's start at the origin, start at the cell level, look at what goes wrong, and you will end up finding out when you have these discussions with your patients, if you can piece that out and you're working with your patient and they understand that you have an interest in what they're telling you, you put that together, you can go a long way with that, because it just doesn't end there. It goes further. That relationship goes further. There's more that can be done. The most satisfying and also most humbling at the same time is that these people that have had pain for 2 years, 5 years, 10 years, you can turn that pain around in a matter of days or weeks. And it's almost surreal for them because they just can't believe it's done. And if you understand and you have that precision-oriented approach, you can take care of it.
But don't be surprised that it takes a lot to convince them. They were told again and again and again by family, by friend, by doctor, so they become very suspicious.
Yeah. And now they had a new lease on life of where they could move forward. And now I had that conversation of, hey doc, what can I do next? How can I stop this? What are the next steps? When you have that buy-in from the patient and you've shown them that you have those solutions, there's nothing you can't accomplish. I could show you people that come into my office with the worst x-ray of a knee you've ever seen. That x-ray might just happen to be because I'm looking at the other knee, and that knee that they're not complaining of looks horrible. It shows terrible arthritis, but they have no pain, they have no complaints, they're ambulating fine. It's the other knee they came to see me for. And what I'm trying to say there is that there's so much about just treating the inflammatory state of a joint where you can keep people mobile. I think that we can do so much more for people before we look at surgical intervention as the treatment and protocol for joint pain.
I can stand up and say without any doubt that big majority of the surgery, they are not a solution. I always look for solution to avoid surgery. Most of the time, the organ that they removed look perfect. So obviously, they should not have been taken out. So there's so many ways to avoid surgery. And once you do surgery, you cannot put this organ back. Every organ of our body has an importance.
If you're experiencing any of these type of issues of where you're having back pain or referred lower extremity pain, knee pain, ankle, wrist, elbow, neck pain, all of these things that may be contributing to a lifestyle that's changing for you, I just want you to know there are answers that can be very significant in changing your life. For your concern in moving forward with anything like this, I have Kim, who you can always call, who will talk to you more about the things that we do and can help you in assisting you to get to Uzzi and I, to take you down this path that I think is changing the view of medicine and the future of how we look at pain and recovery for patients all over the world. And we're excited to be part of that with you.
Thank you very much for listening.
Thank you.